Told you about how Greenville's Bon Secours Health System is screening patients 12 and older for depression.
It's a big program, and tonight we've had new details on how they're taking those next steps to incorporate the screenings into patient care. 7 News reporter Ann Maxwell with more on this new model for treating mental health.
It's called collaborative care, and the goal is to treat or make plans to treat mental health conditions at regular checkups. We spoke with a doctor at Bon Secours who says this method helps patients get past the stigma of mental health issues to get the treatment they need.
What if your annual checkup evaluated your mental health like it does your physical health? That's what Greenville's Bon Secours Health System is looking to do. They've just started testing the program here at their St. Francis downtown primary care clinic.
We know a lot of patients want to receive care in their primary care doctor's office, and so by allowing patients to receive it there, then it's patient focused.
A few weeks ago, Bon Secours announced it would begin screening patients 12 and up for depression.
In general, 1 in 5 Americans have a behavioral health condition, and yet many of those will not seek treatment for about 10 years.
This new collaborative care model brings treatment to them, like it might bring in a specialist for a physical health problem. If patients pass a certain threshold, their doctor will bring a social worker or psychiatrist into the appointment who can either counsel them on the spot or set up an appointment for later. If the patient doesn't show up later, they will follow up with phone calls every few weeks.
We can ensure that patients get better, but in addition to that, we know that their medical costs from diabetes and untreated hypertension are high, and we know that depression makes those conditions worse. So by improving depression in the primary care setting, we also help reduce medical costs.
He says for every dollar spent on collaborative care, $6 are saved.
So collaborative care has such a growing body of evidence to support that it works that insurance companies are starting to pay for this.
And again, they are still in the testing phase of collaborative care, and if it works out, they're planning on bringing it to other Bon Secours facilities.
So I have a Bon Secours doctor. Does this mean the next time I go visit my doctor, he's going to just, give me a quiz? Is that how it works?
Pretty much. I mean, there's a questionnaire, you fill it out, and then you're evaluated on, I think, a scale for your mental health.
And you said depression. I assume there will be other screenings in addition to depression, or is that just where it starts?
That's exactly right. So collaborative care started out just for depression, but since then it's expanded to address things like bipolar, PTSD, anxiety, stuff like that.
Okay, well, it's pretty comprehensive.